Hello everyone. Thank you so much for tuning into my video today. Quick disclaimer, I know you see this ugly band-aid on my finger. It's because my fan turned on while it was in my purse, and when I reached in to turn it off, the fan yanked my nail off. Broke it down, blood. It was a disaster. So if you see this popping in and out, just disregard. Anywho, this video today is about my exchange surgery. Now, I was looking forward to this surgery from the beginning. Like after they finished telling me, oh, you have breast cancer, I'm like, blah, 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 blah. What about these breasts? And they're like, okay, so we're gonna hook you up with the plastic surgeon. And so my plastic surgeon was saying all of the right things, and his work was looking phenomenal. So I was super excited to have this surgery done. Well, 2 weeks before it was time for me to have my surgery, I passed out and broke my ankle in 2 places. So I'm in a big fat cast on crutches trying to have an exchange surgery. Now, the exchange surgery, just FYI, is just where they take the tissue expanders out and they exchange them for your implants. So I was super excited. I wanted my juicy, luscious implants. I'd already had implants for 10 years before I had any of this stuff going on. So I was just like, okay, bring it on. I was excited. Like, oh, new boobs? Who this? So I was excited. 2 weeks before, I broke my ankle. Like, broke it. I'm in a big fat pink cast, and my plastic surgeon is giving me the side eye because he's like, I don't want to operate with all this going on. I'm thinking like, no, please. Oh, please, we've made it so far. please do this surgery, please. And, but we were supposed to, the ortho doc said that I would be good to come out of the cast in 2 weeks. So that was going to put me right where I needed to be as far as my surgery was concerned, because my surgery was in 2 weeks. Well, I saw a spider, and I was trying to kill the spider. I was home alone. I was trying to kill a spider, and I fell on my ankle, the broken, and broke it a little bit more. I know, ridiculous, but I did. And I had to stay in that cast for like a month. So I had to have my surgery with my cast on. Now, you know, after you have a surgery, like, get up, move around. Okay. I had to put the crutches. Now, I had my breast worked on. I had to use the crutches to walk because I can't put any weight on this broken ankle. So that was crazy. But I made it through, okay? Anywho, the day of the surgery was cool. Okay, it was outpatient surgery, so I didn't have the anxiety of staying in the hospital alone. My husband was able to be there. He was in the room with me until they did the anesthesia, and then he went and waited, slept in the car until they were done with my surgery so he can come back in the recovery room. This time they did not do a pain block. So that pain medicine, that anesthesia wore off quicker than I wanted it to. You know, this pain block, I was in heaven for about between 4 to 7 days. I was feeling phenomenal. This time, no. I'm in the recovery room and I'm feeling every nip and tuck that they have done. And I'm laying there just trying to get my bearings, and the nurse, which is not my plastic surgeon's nurse, this is the nurse for the hospital. He's in like, okay, so we're good, and you got shoes. Like, excuse me, I just had surgery. If we cannot rush me out of here, that would be great. And I'm in a lot of pain. He's like, okay, I can give you pain medicine. And then I sit up and I'm like super nauseous. He was like, he slathered this cream on my arm, put a piece of plastic over and was like, all right, so look, if you're not ready to go, and we can admit you, but you can't stay here. I was like, okay, let me just get my little bag. Me and my husband, we will leave. We've been kicked out of better facilities, honey. We have not. But he kicked us out. And I'm like, ew, this is kind of rude. But it was the pandemic. I know they needed beds and all of that. So I was mindful of that. Did not get an attitude with him. I was just like, okay, thank you. And we left. But I was in so much pain. Every step was, well, not every step, every hop, because again, I have a broken ankle. So I'm on crutches. And at this point, I have a walker that D is pushing me around in, but it's still painful because he's hitting every bump. Like, boom, he never could have been a nurse. He hit knees going like, oh, my bad, babe. Boom, oh, my bad. Dude, don't you understand? It's not the ankle that I'm worried about at this point. These breasts, these bumps that you hit making me feel like I'm about to bust open, okay? So, but so that was the thing. I was in pain because they did the regular anesthesia that holds you over until they finish cutting on you, and then it's like, okay, you're on your own, sis. So of course they sent me away. I had my pain medicine and my antibiotics again, of course. So I took that, and honestly, within a few days, I was feeling pretty good. And it's coming up to Thanksgiving, so my mother and father-in-law came down just to kind of be with me because my whole breast cancer experience, they weren't able to come down because it was the pandemic, and they're in New York, so it was not like, yeah, they could just hop on a plane and come and just, so no. So they were here they came down when I had my surgery. And they stayed with us for about a week. And it was really good. It was good to have them at the house. And I was still recuperating, thinking that I was about to come. Even after my surgery, I was like, okay, well, cool. Once I get out of my cast, and I'll be great. I'll be in a boot and I'll be able to do my thing. No, I was in the cast for a few more weeks. And then I finally got in the boot. And even in the boot, I was non-weight bearing and having to be on crutches. So I'm just like, ooh. The breast and this crutch, they are not a duo made in heaven. They are a duo made in hell, okay? So I'm like, whoa, this is, I'll just get my walker and I'll scoot. I'll put the injured leg up and I will scoot on the good leg. And that's what I did, okay? Now, in my follow-up appointment, I noticed that now my original tumors, two of the original tumors were here. Here, I'm not sure if you can see it, okay? Now, I'm noticing that I see a knot, like a lump, right here. So, like the original tumor, knot. And I'm concerned about it. I'm not deeply concerned, because I do understand that I just had surgery, and I'm thinking, well, it's probably just, your body does weird stuff when you have surgery. So I was talking to my plastic surgeon about that, and he says that he wanted to keep an eye on it. And I had an appointment with my breast doctor, and I told them what was going on. And the breast doctor was like, well, it's probably scar tissue. And I'm looking at him like, you are my breast doctor at a cancer center. I am a breast cancer patient. I'm not about to go along with the probably. I need some tests run. Okay? You need to find out exactly what this is, because I don't want to deal with a probably, because it's probably not just scar tissue. Thankfully, the physician's assistant, she's so sweet. She's literally the best thing at that hospital. She's the best. But she did an ultrasound and saw a coil in the lump that was on my breast. And she called the doctor in, and the doctor stuck a needle in. He didn't do the regular biopsy where they, they cut and then stick the thing and chunk the piece down, take it out, all of that. It wasn't like that. This one was just like, he stuck a needle in it, pulled some of the fluid out, tested the fluid. And he's just digging. Like, dude, I just had my breast done. Don't do that. Stop. So they ran the test, and the test comes back, and it is, drum roll please, or bracelets clinking please, breast cancer. It's a cancer, it's a tumor, okay? This is not just scar tissue, this is a tumor. So I'm super happy that I said something and that I insisted that they test it, but also confused because when I had all of my appointments and all of this, at the end I talked to the doctor and he just felt so great about everything, told me I had a less than 5% chance of recurrence, and he was just like very positive about my outcome. So for it to be breast cancer, now I was declared remission in September. Total remission, they said I was in September. And then here we are, December, and you're saying that I have breast cancer? How? So I wasn't crying or anything like that, because when I was diagnosed the first time, I boo-hooed, I cried like a baby. And I realized that none of my tears dried up none of the tumors. Like 3 tumors still there after I finished crying. So I was like, I'm not wasting that energy on that. But what do we need to do? What's our plan? And the plan was to have another surgery and then to go through the process again. Anyway, that's all I'm going to give you for today, because it's enough, okay? Enough. But anywho, in my next video, I'll tell you about my following steps, because at that point, baby, we are in season 2 of breast cancer. You hear me? We have made it. I'm currently in season 2, so I'm catching you all up to present day. Okay? Anywho, thank you so much for watching. As always, remember, positivity is medicine. It really is. And it's not just medicine for cancer. Positivity is medicine. It's daily. It's like taking your daily vitamin, like your multivitamin. Positivity heals. Positivity soothes. So remember that. Positivity is medicine. Also, I like to live my life with a clear mind, a pure heart, and good intentions, and a strong body. Now, again, this muscle looks like nothing on the screen or whatever, but I have a little muscle going on. I've been in the gym, baby. She's gonna want to see that little cut right there. So, anywho, thank you so much for watching, and I will see you next time.